How do you innovate in an environment that is so freaked out about compliance and audits and regulation?
The challenge with healthcare is, as you mentioned, there's so many moving wheels that innovation becomes really a crawl. I used to struggle with why it was so difficult to innovate in any healthcare environment. But then I realized that they're scientists, and scientists need evidence and peer validation. And the challenge when you're trying to innovate is that the standard healthcare IT team isn't designed for innovation. They're designed to protect the business. We trust technology so much that we won't question any part of it, really. And it's that in itself is so dangerous because AI hallucinates. We still don't know what it's going to do and what it's going to say and output. Oftentimes, we don't control the algorithm behind it. Systems need to make things easier for those who are delivering care. Every system in place must make it easier. When someone's life is on the line, time is of the essence. Sometimes you do not want to listen to the technology expert because the technology expert is not on the ground delivering care. You are.
Hey, everybody. Today on the newly revised Above the Tree Line platform, this is episode 26. We have a special first guest on our new platform, Wylie Blanchard. Wylie, thanks for joining us.
Thank you, Andrew. Really appreciate being here.
Yeah, absolutely. I'm super excited to talk to you. You and I met a number of years ago. I think we said it was at Document Strategy Forum.
Yep.
We were on a panel about something. I completely don't recall. But at that point, you were involved in the customer communication space, at least tangentially.
Yep.
And we had a chance to intersect. But anyways, I'm super glad to have you on. You've got an Amazon #1 bestseller book in the, what is it, the IT healthcare category. I wasn't exactly sure to figure out which category, but there it is, right in the #1. So congratulations to that. We're going to talk a little bit about that. And I think I'm going to say it right off the bat. The thing that I was most impressed with in your book is you did not mention the letters AI once. I didn't read. I might be wrong about that. But I think that's pretty impressive to publish a book in November of 2025 and not talk about AI. And I think that just speaks to the confidence of your program and, you know, the challenges that exist, not just in the healthcare space, because your book is called Zero Downtime Care, the care being related to healthcare. But I think we can talk through that a little bit because it's really applicable, I think, in many other industries. So it's great to have you here. So thank you. Why don't you tell us a little bit about your background? How did you get to Reinvenity and helping healthcare providers? And I think you should be clear about that. Oftentimes what I talk about over here is healthcare payers, right? The insurance companies.
Yeah.
You're on the truly the mission critical side of people's lives being dependent on, you know, test results and doctor's appointments and all of those things that take to operate a hospital. But how did you get here? What was your path?
It's been a long road. That's just, you know, reflects my age. How long I've been doing. Well over 25 years that I've been at this thing. And so I like to say that my career began with Blue Cross Blue Shield. And I worked there for about 8 years, Blue Cross Blue Shield of Illinois. And I also had some impact in Blue Cross Shield of Texas. And I got a lot of my experience working with that company, moving up through their technology program and getting into their leadership, building new solutions. One of my call to fame was my team helped. The sales team sold a healthcare savings plan before the system could adjudicate the medical claims for this new plan. So my team was responsible for enhancing that solution, and then manually working the claims through the system until the system could correctly handle them. So that was part of that career. And then from there, when I left there, I started consulting.
Okay.
And in consulting, I just leveraged my experience, and I worked with some clinics, Lawndale Christian Health Centers, which is in Chicago, some other health practices in the Chicagoland areas, a couple nonprofits. I consulted with GE Healthcare for a time. And that's really where, you know, my healthcare experience started. And from then, I've continued to work with health-focused organizations, whether it's the state of Illinois and their health program, or more recently, we worked with University of Illinois Chicago with their public health department. We're still working with them, and it's been a great journey. It's been a good journey.
So you really are on both the payer and the provider side then. Really, I mean, you're sort of
you're touch both sides. Yep.
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 Yeah. Well,
Not with Apple, but only with a computer, only with a keyboard.
Well, it's people have asked me, Andy, where's your healthcare research? I'm like, that ain't my thing. I've been pretty intentional about not spending a lot of time in the healthcare space because it's hard. It's complex. It's very specialized, and the folks that are really successful in providing customer communication services in that space tend to really be specialists in that space. No disrespect to my friends in banking and, insurance payer side and, financial services and stuff, but we were watching this show called Doc. I don't know if you've watched it, but anyways, one of the episodes was their IT system went down and they couldn't get test results. And that was sort of the whole story was around this idea that the system was screwed up in the background. The doctors prescribed the wrong medicine. Somebody died. And, that it probably is worst case scenario for the teams you work with, right? I mean, that is absolutely the worst case scenario. People in banking don't necessarily die. They might go to jail, but so tell me about that experience. Tell me your vision on how you've seen the communications industry evolve in healthcare over time, since you've kind of been in some different places. You spent some time, I believe, at Donnelley. Is that true? I think, yeah.
Yeah. So that's completely correct. Yeah, I worked with R. Donnelley for a number of years, probably about eight.
Okay. So you've seen this space from all different angles, and I'd love to just kind of get your assessment on sort of where are we? What's sort of the state of the market from a customer communications perspective in the healthcare space?
Well, let me start with this. So my first interaction was with healthcare communications was with Blue Cross Blue Shield of Illinois, and that's actually where I first heard of R. Donnelley. Like, if had I not heard of it when through Blue Cross 20 something years ago, when I got there, I probably would have never heard of it.
So really,
yeah, but I did. I was familiar with them only because I knew that they were printing the medical claims and sending them out to the patients, to the members. And at that time, it was critical because there was an issue with what was printed, that there was like one out of date statement. But a customer called in to inquire about this out of date statement, and it was a big deal. And then there was a lot of meetings around it, and then we had there was conversations with the printer, and then everything was corrected, but the team was looking at how do we make the member whole. And they told me something you've written, not an incorrect statement, but a simple out of date statement could cost the business money, like significant money, or cause enough harm where a large group of people had to spend a significant amount of time trying to rectify an issue that seemed small. So it's critical. It's business critical because it needs to be accurate. And I think that is the biggest interesting component as today, because, as you mentioned, AI is the hot topic, but we're really allowing systems to make a guess of what to do next, and then give it permission to just do it.
So Wylie, what you were just describing, that accuracy, that need for, it's, the old saying, 99% correct is 100% wrong, right? It's got to be correct. And today, more than just correct, it's got to be readable and understandable by a human being, right? And I think that's a big part of what's going on in the industry. But so you've seen the critical nature of transactional communications. Obviously, I'm going to guess that you came from that world of print. I think we're just talking about printed communications. What's been the biggest change in terms of communications that you've seen in terms of how healthcare? Again, we've got payers and providers. I don't know if you see them differently, but what's the biggest change that you've seen in that space since you've been observing it, involved in it.
I do think there's a big difference between the payers, the insurers, the brokers. I think there's a big difference between all of them. With the brokers probably have the most flexibility because they tend to lean toward what their clients are doing. The ease of which you can get access to the information that you want is plentiful today. So, you can get information about your medical status from your smartphone in a number of ways, either through the company client app. I've even seen companies put key information about health-related activities into the mobile wallet section of your device, where the way you have which is really interesting because it's a online offline product that you could keep just to yourself versus an app is completely online. I mean, you have to have access to it too. So I've seen that nature. The access in which we can get the information we want is more plentiful than it was yesteryears. That's the biggest change.
Sort of thinking about that perspective and then the prior perspective of accuracy and the ability to have the predictability. So there's been a lot of innovation, right, in terms of how patients, healthcare consumers have been able to sort of interact with their payers and their providers, scheduling, all of that. But tons of regulation, right? Tons of legacy systems. How do you innovate in an environment that is so freaked out about compliance and audits and regulations and that it just I can picture walking to a room of IT guys and you bring up some of this stuff and they're just like, please be quiet. You've clearly have worked with a lot of companies to help them figure that out, right?
Yeah.
To deliver those new innovative experiences that healthcare consumers are requesting, demanding. I mean, in some ways it's a competitive, advantage that a company may have that they can allow people to interact on a mobile device. But, kind of getting into your book, the zero downtime, these mission critical systems, I mean, that's exactly right? Zero downtime.
Yeah.
And you're talking about innovating. We haven't even, like I said, I'm impressed you wrote a book without mentioning AI, but where do you start?
That's deliberate, by the way. So it's
I'm sure it was deliberate, and I think it's impressive actually, because it's exhausting. And as soon as you bring up AI, it's like all of a sudden you're off to the races. And what were we talking about again? And I think the stuff in your book, I just read this as not as somebody from a healthcare industry, but anybody that's got an environment like that, and they're everywhere.
Yeah, the core concepts can apply to almost any industry. The challenge with healthcare is, as you mentioned, there's so many moving wheels that innovation becomes really a crawl to get there. Mm-hmm. And I used to struggle with why it was so difficult to innovate in any healthcare environment, whether it's the clinic, the insurer, or even the support firms that help ensure that they move forward. But then I realized that they're scientists. And scientists need evidence and peer validation. And that means it's going to be slow. That means I have to convince Dr. A and then convince Dr. B, and then they want to look at it from different angles and ask a million questions. And then once they're happy that this thing isn't going to explode, then okay, let's iterate the thing into existence and see what happens. So once I'd made that kind of distinction that, scientific methods imply that it needs to be slow, I was a little bit more okay with it. But it's slow really essentially for all those reasons you mentioned. One, the healthcare leaders, really the administration, the healthcare administration, they're not techies typically. Often they're healthcare practitioners who've moved into the administration's role, or they've deliberately been started as a healthcare administrator and have moved up into their role to help lead something. And it can become a challenge with all of the vendor pitches, all of the new hotness, and then the confusion that your technical team can actually provide you. That can be challenging and confusing. So it can be really hard to filter through all of these different messaging that you're getting, and to really make a decision on how to move forward. So what I did was really just say, hey, here's the key things you need to know, or ask these technical people and these vendors to help them get back to where you're trying to guide the company into. And you don't need to be a technical person to actually ask these questions. You just need to have a framework in place to gear them back into what really matters, which is really your patient care.
And that makes a ton of sense when I was reading through the book. I mean, that completely makes sense, because, you know, what I thought was really interesting is you would have these like board level talking points.
Yeah.
And maybe we should pick out some of the different chapters, but you know, you're like, okay, on this topic, here's kind of what they're thinking. Here's what they're going to need to know. Here's what some of the myths are that they might believe that you're going to need to dispel. And again, as I was reading that, your description of these are clinicians, right? These are scientists, I think was the term used. And now we're asking them to make a decision about the next, IT stack or whatever we're going to do in our mobile app. And I had never really thought of it from that point, but it's incredibly insightful and I think incredibly valid. And I wonder, again, I don't think that exists perhaps in banking and financial services and in the traditional insurance payer world, right? Those people probably come from a more traditional path that are building these products and serving those markets. But healthcare, maybe this is speaking to that question I have, is why is this stuff so darn hard? Why is it so complex? And that is a great explanation. So thank you for that. So you have the care modernization framework, and that's kind of, you built the book around that. And sort of the framework about how to think about things: clarity, alignment, regulations, engagement. And you go into a lot of detail around each one of those. But why don't you kind of take us through the framework of the book and how you get people, and not just, like you said, it's not just picking out a vendor. It's what is the problem we're trying to solve? What's our budget? There's a lot of bits and moving parts here that all have to come together to do this well. But it seemed like what you were really suggesting is bite-sized pieces, right? Just incremental, show success, build on success.
The framework was really designed, and the book forced, the interesting thing is we've been using the framework for a number of years.
I suspect
that to give case. So,
yeah.
When you have to name the thing and give it, some meaning, the book helped center that so that we can give it meaning. But yeah, it really centers on those things. So the first one was clarity. What are we working toward? What's the goal? Why are we even doing this thing? Right? Is it because we know our systems are outdated and there's better systems in the market that we should be considering using? One of the key concepts I have in the book is that don't go through a whole modernization effort if it's really not worth it.
Yeah. If it's kind of like, if it's not broken, don't fix it, was a little bit kind of how I read that.
Right. There's no need for full blown out modernization if you're just trying to enhance one small component, because it's overthrown. It's, if it's not worth a certain amount of dollars, or if it's not worth a move that's going to drittily change some important component of the business, a critical component of care, then it's not necessary for you to go through a full, what I call, care modernization effort. It may just be easier to just make the decision, do the thing. From switching email providers, do I really need to go through a whole meeting with my entire leadership team and the board? Probably not. Just, if they're close, if they're apples to apples, make the decision. But it all starts with, what are we clear about? What are we going to do? What are we working toward? What's our end goal? And then putting that in writing, and then ensuring that everyone's on board for it, essentially. Technically, that's a simple leadership method.
Yeah. I mean, that's kind of 101 kind of stuff, but
and
then you're talking a different kind of group of people too, that maybe don't have the background that.
Well, people make things complex, right? That's just human nature. We're hardwired to make things complex. And in my opinion, it's really very difficult in a healthcare environment because healthcare is one of those it's one of those industries where you can be involved in it really from extremely young age all the way to a very old age. Like most medical doctors start right out of high school, start a medical program, and then are in medicine well into their 60s, 70s, and sometimes longer. In their experience, they really live off their life experience more so than what I believe, once more so than the technology. And that means that they have a very crisp opinion that's guided by their experience. They're opinionated, which is fine. Which is fine.
Yeah, yeah.
Which
Not
ultimately mean that they're
complex, what some
stubborn.
people would describe it as, but
Well, rightfully so. Rightfully so. If you spent 30 years building your expertise, and now it's been 50 years, you know what you know.
yep,
And,
absolutely.
and you know what you've probably seen some changes that hurt care, and you've seen changes that maybe improve care, and you're going to be opinionated about. So making and when you're in those discussions, they can be difficult, and they can be hard, and then sometimes you do not want to listen to the technology expert, because the technology expert is not on the ground delivering care. You are. So that your opinion holds a little bit more weight. And that it means it's going to be a difficult discussion, which is why that line pillar is so important, because we have to make sure that we remind the team that we're working toward a particular goal, get everyone on board for that goal, and then challenge them whenever something steers slightly off path. And that's the biggest challenge. The bigger one is steering, in my opinion, is really so. Let me reframe this. That is natural for the healthcare practitioner to steer their team, but steering in vendors, outsourced providers, your IT team, consulting experts, that's outside of their.
I was going to say, it seems really unnatural for them.
Right. It would be, because you're not interacting with that on a day-to-day basis. Maybe your administration team has some impact on that, but typically your IT team does. And the challenge when you're trying to innovate is that the standard healthcare IT team isn't designed for innovation. They're designed to protect the business.
Yep. Keep the lights on, keep the security tight, maintain the stack.
Yeah. They're designed to be invisible, to not interrupt the flow, to keep the thing working. And innovation means that something is not going to work the way we intended for a period of time, and that's going to be difficult. And humans are not typically okay when you disrupt them. And then healthcare staff normally definitely are not okay when you disrupt them, because they're on the ground trying to deliver care today. Right now, they don't have time for things to work tomorrow. And that can be hard. So the natural inclination of the technical team is, especially your internal technical team, is, well, let's slow down. Let's not do that yet. Let's protect, let's minimize, let's work with someone I know and trust, which may not always work toward, what we're trying to innovate toward. AI is a good example of that, in my opinion. Like, because AI is one of those areas where we really don't know.
No, we don't.
If we let this thing make a decision,
Yeah.
I don't trust Bob, and I've been working for Bob for 30 years.
Yeah. Well, I mean, at the end of the day, it's still going to be that group practice or that care provider's brand that's going to be on the line. It doesn't matter whether AI made the decision or not, right? So,
and the interesting part is everyone's concerned about the business brand, their personal brand, and each one of the technologists that you have to work with are also concerned about their brand. And innovation can interrupt and threaten that brand when you're walking into the unknown. And they're not trained for innovation.
Yeah.
They're just trained to protect the business.
Yeah, exactly. Well, we talk about innovation, and it's that's always fun, right? It's always fun to be, what's next new, what's new. But then there's also, this, you can't stand still, right? You can't just not move forward. And you talk a little bit about the risks of outdated systems, and I got to believe that list probably goes on forever from a security and an integration perspective. But how do they find that balance between it ain't broke, so let's not fix it, and hey, if we did modernize, look at all the interesting things that we could do, and serve our customers and provide better care and all those things. That's got to be just a really that's got to be a tight rope to walk with a lot of these folks in terms of trying to find that balance of.
It is a challenging balance. I like to believe that once someone is in a position to drive an organization, they have a vision on what they want the organization to be. And ideally, there's some component of in there that includes modernizing, our systems so that we're state of the art. But the reality sometimes is that there has to be some other incentive to actually make the thing happen. Reputation can be part of that. Sometimes there's money on the table to innovate. There are grants for innovation. If you're doing something new in X field, the organization could make more money. That sometimes introduces it. But yeah, to your point, it is really a difficult thing to plan toward. It's my opinion that we should always have that plan, and then we have to force ourselves into putting that on the docket of discussion on a monthly or quarterly basis.
Yeah, you can't just wait until it breaks. I think you had a name for that. Something where it's just I can't remember how you phrased it in the book, but it was something about the hidden threats, I guess is what you call them, those silent kind of like silent risks that are out there that are just kind of sitting there waiting to explode.
Yeah. And that's an ever-ending list as well. If we don't make sure that our systems and our technology is where it really should be, then we risk essentially everything that I just mentioned. You could not qualify for a grant if you were hoping to make new revenue, new opportunities through a grant, simply because you don't have the systems in place to deliver on the intended goal. You could miss that key critical window. It could cost you money, not innovating, because you may not deliver something within a regulated time. There's if there's examples that if there's a small breach, we're required to notify regulatory bodies that a breach happens. But if you don't have a system in place for a particular type of breach, or you don't have a system in place to catch that breach or stop that breach, you may not be able to hit that window of notifying those intended parties that breach didn't happen. Yeah.
And that's when bad things happen. So, in the care framework, we've got clarity, and then, maybe that's the alignment part, right? Where, I think this was interesting, and I think this was in the alignment section about compliance, and we haven't really talked about compliance, but we're obviously working in a highly regulated industry where there's lots of audits, lots of compliance, different, every state, right, is different. I have this interesting theory that a lot of the customer communications industry, kind of stepping back into that topic, is compliance is sort of the hurdle, right? It is the thing that it's almost like the industry in some ways is motivated by fear, right? Their fear of missing, some kind of regulatory compliance, SLA or whatever that is. And so there's always operating from that perspective, which I think is really constraining. And I think you had a different view on it, which, this idea of compliance frameworks, guardrails, to me, it says, hey, you can run as fast as you want as long as it's inside those guardrails. And I think companies seem to forget that sometimes. They just put on the blinders and go, oh my gosh, risk. And some ways, I think those frameworks are really there to just allow you to go as fast as you possibly want or can, as long as you play by the rules, right? I don't know what your thoughts are on that. I'm sorry?
As long as you're ready for the change, whatever the change is. So as long as you're ready for that.
Yeah. So going back to the alignment piece, though, I think the myth that you had is compliance slows releases. Compliance says, ooh, I don't know. We better go check with the compliance officer and see what he or she says.
And sometimes we can forget to involve, depending on the size of the organization, you may forget to involve your compliance officer or your compliance team to ensure that, you've met the regulation and you're not doing something outside of that regulation. It's an interesting balancing act. I remember when the rule came that you have to give someone the choice to opt in or out of getting them communication.
Mm-hmm. Yep.
But it didn't say how. How do you deliver that? How do you deliver them the opt in out? Is it verbal? Is it written? And then the next question is, okay, if I've gotten opt in to, I've gotten your permission to send or not send you a communication about your care. How do I document that? How do I evidence that? Am I evidencing too much? Because we there's rules. There's also regulation on how much I maintain about your health, and then who has access to that key information about your personal private health information. So there's a lot of question on how do we maintain it? How do we control it? But there's not a lot of direction on what to do next. Regulation doesn't really tell you what to do next. It just tells you, here's a guardrail that we've put in place, and now go figure it out.
Yeah.
It also implies you have to prove that you did the thing.
Exactly. And I think that's the world that we're moving into, and there's already regulations in Europe that say it's not enough to say you sent something and prove you sent it. You have to prove that it was actually understood, which is a whole different thing than just saying, hey, I produced it, I put it in the mail, it got delivered. Well, I don't know. Now did the recipient actually understand that communication in a way that was effective for them in serving their needs? So it's a whole, we're entering a different world, and it's just going to be interesting to see how things like AI, it has to consume a lot of your conversations. People just have so many questions, and they're probably asking AI the questions they want to ask you. And, it's just this world. We live in this strange world where if you give me information, I'm going to go to AI and double check it. It's like, we don't even know who to trust anymore. So how do you think this is going to play out in the healthcare space? Is it just wait and see? What's your opinion on that? You're right. You're as close to it as anybody.
It's going to be a fight, because the innovators, the companies that are creating the solution, want their solution in everyone's hand, and they're unrelenting. They're not going to relent. But in the healthcare space, there's been a lot of legislation recently passed or pushed, indicating that that AI must indicate that it is not a healthcare practitioner. It is not an expert. It is not an expert in health. And it's not giving you health advice. It must tell you that it's not giving health advice. Otherwise, people will assume that it's accurate. We trust technology. We trust technology so much that we won't question any part of it, really. It's that in itself is so dangerous. So that is one of the few areas that I know definitely needs regulation around it when it comes to something that's so life critical. But it's definitely going to be a continued battle. I think that the healthcare practitioners and their administrators are working hard to make sure that there are guardrails about it, and ensuring that people know that they're not getting advice from a health certified practitioner. But at the same time, I think they are starting to understand that there's really no stopping this part of the innovation cycle.
It's just a big giant black hole that's sucking us all in. That's how I think about it. It's inescapable. And I think you're absolutely right. It's interesting. You'll go to a conference, and again, in this case, it's going to be financial services, and you walk around and every vendor on the exhibit floor has got AI in the booth, right? AI. And then you go up and you hear actual use cases from customers like, we ain't doing any of that. So there is a disconnect, and there's some hurdles that I think are really coming up quickly in the regulated space that is going to say, well, hold on a second.
Right now, especially in this regulated, the healthcare regulated space, in the few industries that companies I've worked with who are testing AI, the default is to direct back to the core system, to the customer, right? Give them general information, give them some key information, but redirect them back to a trusted source, which is in most cases, the trusted source is the company's house information to get additional detail.
Yeah.
Yeah.
So you
I'm
talk about,
confident that's going to change soon, though.
yeah.
Yeah, that's going to
Well,
change.
you bring up core systems, and it just makes me think. I grew up in Verona, Wisconsin. So if you know what Verona is, the home of Epic Software, and it's yeah. So and I lived right down the street from that campus was started being built. Now, if you've ever been there, if you ever get a chance to go, it's if you ever seen pictures of it, it's insane. I mean, the campus is massive and it looks like Disney World. It's really quite something. Yeah, no, it's really interesting. But how did systems like that? I mean, you were talking about doctors and clinicians and scientists that are delivering care, and all of a sudden you got this Epic system showed up, and now instead of talking to your doctor, you're talking to the back of his or her head while they're over there. That, and there are other systems like Epic. I'm not as close to the space as I would like to be, perhaps. But how are you getting involved in sort of those levels, or is it sort of like those decisions are made and now you're just working on all the stuff sort of around that experience? I mean, where does a system, that core system like an Epic, fit in sort of the broader scope of the things that you're working on?
So right now we're working with mid-size and small businesses. We work with large organizations when it comes to specialized projects, and there have been a few conversations on, what key electronic record systems that we want to utilize. Epic is always in discussion because it's a big player in the market.
Yeah.
But there are others. I don't.
Yeah.
SAP has a variation of it, and a lot of other big vendors have variations of it. It often can come down to one, cost, and two, the leader's experience with said systems, knowledge with said systems, and trust in said systems. So it's more of a balancing act. And I found that many technology experts lean toward what they know. Because if I've been an Epic, if I've used Epic in the past, if I was an Epic analyst, I probably would lean toward Epic. But if I've used another system, I probably would try another system. Other times when it comes to cost, it's slightly a bit riskier, because if cost is a factor, then you're probably trying a newer player, one of the more trusted systems, which means that's going to take a significant longer decision, where that align pillar comes back into play, where, how does this different system really align with our core goals? Do we want to be a best in class? Well, best in class would be what everyone else is using, which is those traditional systems. Or do we want to be an innovator who's helping to launch something new, which would be one of those newer systems? So it's that balancing act is really challenging. And what I do in the book is try to guide you to creating I don't call it a ranking system, but a process is where you have process of elimination, essentially, where you jot down what your key goals are, what your requirements, and then you rank each of the different systems based on how they align with your objectives and your goals. And you have all your team members do the same thing. And then based on that, you try to guide what's in the best interest of what your innovation plan is. And I found that to be the best method, because otherwise it's really just my emotional feel at the moment and me basing a decision based on that in my experience. And putting it on paper, writing it down, makes it a little bit more tangible and removes emotion and personal objectivity out of the decision making. Oftentimes that's the best path.
I really appreciate you bringing some clarity to the question of why is healthcare so hard, and I think I've got a much better understanding of it now, because it is different. It is very different. And, but it's related in the sense that we're talking about customer communications and, companies that are dealing with innovation, dealing with updating systems. A lot of the stuff I spend time on is customer communications and CCM platforms and all the big vendors and those spaces. And, it's the same kind of questions that are being asked, right? And the same sorts of challenges. It's just that it really comes down to the people making the decision, I think, is your point. And in this case, in healthcare, we have people that come from a different point of view about the nature of the care and the systems that are going to provide that in a healthcare setting. So it's really actually pretty fascinating to really understand that at a better level. So some of the different things that you put in the book, you've got these boardroom conversation starters. I mean, are there a couple that you'd pull out and say there's somebody that might see this podcast and is like, gosh, we're struggling to put a team together, or boy, I wish we could really get that mobile app to work, or whatever that might look like? What are the couple of things that you would say to those folks to just sort of, besides buy your book? That's okay if you say that, but what are the things that they should be thinking about?
So I say definitely get the book. That's a no-brainer. But understand what your options are. Especially when you're thinking about your technology and how you're going to innovate it. You have a lot of options in the works. You have your internal IT team building that out. You have different type of providers. You have specialty. You have specialty boutiques that specialize in just one little thing. You have your managed service providers. You have your managed security, cybersecurity service providers. You also have staffing firms. So you have all these different options. I think I listed out about 15 or 20 options in the book that you have to build your team, and know that each one comes with its pros and cons, right? If you coordinate with a outsourced provider, then you've removed a lot of the internal responsibility, but you don't have as much control, right? If you work with a specialty boutique, you'd have a lot of the strategic control, and then and a lot of the operational control, and then they're only responsible for what I would consider a task. Understanding that what those options mean is probably a key critical thing that someone needs to do who's in leadership. And then making sure you're involving your internal team in this process is another key one. Have we touched into their perspective, their insight, where they should be involved, who should be involved? And then I think the biggest one, in my opinion, is making sure that each one of the key critical things that you're working on has an internal named owner who's the primary responsibility for reporting back to you or reporting back to your board. I don't think it should be a department. I don't think it should be a team. I think there should be a specific individual who should be responsible for reporting back into the organization.
Yeah, I mean, it's, like a lot of things, sometimes it's just common sense, but it's having somebody that's had the experience, that's gone through that so many times and worked so many organizations say, yeah, this actually does work, guys.
Well, the interesting thing is a lot of organizations don't do it. Like they don't go through those every single exercise. Maybe they go through components of it, but just having a named owner is something I've seen not happen. Yeah. Oftentimes it's a department who's responsible for reporting it, but no key critical individual. And the benefit of once you have a person who's responsible for that communication, they now know they own it. Everyone else knows who's on it, and there's elimination of finger pointing. We know who to call on to when something happens. That doesn't mean that you don't have a backup person. It just means that we're going to give each one of these critical tasks or critical operations some ownership. One of my biggest pet peeves with AI in any AI initiative is that it specifically requires a named owner, because we do not know what it's going to output. And if you cannot, to this day, until AI existed, we could traditionally predict with 99% accuracy of what the system is going to do and say. Today we don't, because AI hallucinates. And unless we have guardrails in place to control that hallucination, even if you have the guardrails to control that hallucination, we still don't know what it's going to do and what it's going to say and output, because oftentimes we don't control the algorithm behind it.
Right.
And if the company behind it improves the algorithm, now the output is potentially going to change.
Yeah. It's that issue of explainability. Like, you got to be able to reach into that black box and pull out, here's why we made the decision we did, and here's the proof. And
which is
if it doesn't point to the right stuff in the right order, it could be a really big mess.
Which is why the regulation piece comes in play, because we need to make sure we're auditing the system and validating what AI says, but we need to have someone who's actually going to be responsible for that output, who's actively involved in controlling what that output is going to be.
Yeah, amen to that. And I think that's the hurdle. I think we're going to be stuck in this space for a little bit, until we figure some of that stuff out.
And that's going to be the hardest space, because that's what we're fighting right now, because the innovators who are creating the AI solutions don't want the guardrails. They want it to be able to do what it does. And we want to make sure that it's accurate. We want to make sure that the output is going to be accurate.
Yeah.
We don't want to have those conversations in the healthcare room again with all our leaders saying that, oh, it gave information that was outdated or only slightly wrong, and now that's going to cost us time and money. And it will.
Yeah. We've kicked around this idea of slightly wrong at scale is a really big problem.
It is a big problem.
I wanted to touch on a couple of things here before we wrap up. You brought up customer experience, in this case, employee experience, which you spend quite a bit of time on in your book, kind of talking about, hey, these things aren't always necessarily initiatives that result in patient care. It might just be a time saver for, the person that's making appointments or inputting data into the chart or whatever. And it seems to me that employee experience component is pretty significant in the healthcare space, because there's so many people involved in moving a patient through the system. Is that am I kind of right about that? Or I'm just kind of thinking that employee side of this question is a big one.
Well, yeah. So systems need to be make things easier for those who are delivering care. Every system in place must make it easier. When someone's life is on the line, time is of the essence, often, essentially every time. And if something's stalling, not working the way it intended, then that's going to cause us critical time that could be the distinction between someone's life and death. So in healthcare particularly, it's really the main space where any system that's in place must be easy for the healthcare practitioner to utilize. It must deliver exactly what they expect it to deliver, in the time frame that they need it to deliver. Anything outside of that is just unacceptable in all cases. And I think that's why, and that's particularly why making a change in the healthcare space is so slow, because we also need to make sure that it's going to be effective for those who are actually delivering the actual care.
Have to use that tool, whatever that solution is. So what advice, just to wrap up, you've sort of been in that outsourced managed services space, now working with customers, clients that might be sourcing those types of vendors. What would you give and in this case, I'm talking particularly the outsourced communications side of the equation. So perhaps this is more on the payer side. But what advice would you give to those companies that are looking at the healthcare space, seeing it as a growth opportunity? Because I think in some cases it is. But what would you say to those companies that are you're a print service provider, you're looking to innovate, bring new capabilities to market, then you're going to bring that into a champion at a clinic or a hospital. What do they need to come armed with? What is the thing I'm just thinking just off the top of the head, how are they going to need to start thinking, I guess maybe is the first question. And then number two is, how are they going to need to operate perhaps differently than they have in the past as a outsourced service provider?
Yeah. So it's a couple of things. So it has to be in alignment with what the market already sees the innovation, sees the direction of the world going. That has to be there. Or it must be a iterative improvement on where we think the market is headed, because we're highly creatures of habit, and convincing someone to make a change must feel like it's their idea in order for them to be on board with it. That's also typically the biggest kicker. It is possible though. I've seen some amazing innovations. Video medical consultations was a big change that I thought was amazing. The different ways that we're communicating, delivering communications to patients has been amazing. I'd also say that plan for it to be slow, right? Because it can be difficult to get that on board. And then delivering it out to the recipient is going to have to go through those cycles, legal, the practitioners, the legal teams, the compliance teams, the regulators. It's going to have to go through that cycle. I remember when one of the Blue Cross plans delivered its voice app into the market. They were the only one. They were the only health practitioner with a voice-enabled app for like 4 years. It's like 4-year period until I saw the next healthcare plan with an app that did voice communication. So it's going to be slow, and then plan that out, and then have your champions on board, and in my opinion, make your client the champion. If you can actually make the client the champion of the product, then they're going to help you push it forward.
Wow, Wylie, there's just so much goodness and everything you say and in your book, and I can't wait to share it with people. Is there anything you wanted to kind of cover before we wrap up? Any other topics that were sort of on your mind that you wanted to just mention before we? And I'm just going to put a marker here so we.
Yeah, I wanted to speak on that AI component. What you mentioned earlier, though, the book deliberately doesn't mention AI, right? The zero downtime care deliberately. I think it's a great topic, but I think there's so much. When I approached the book, I wanted to make sure that I created something that I thought was going to be of value to those who are actually doing the actual day-to-day work, who are out in the field doing that work. And there's so much out in space today, in that space. One, I wanted to make sure that I'm credible, that I've done enough work in AI to actually have an opinion on it that could be valuable. But two, I wanted to make sure that the product matures enough and is stable enough where what I create in the market in space actually has value over time. And I think that's really, really difficult to do today with AI because it's so rapidly changing. And I would appreciate that, particularly in the communication space, that many of the organizations slow down and ensure that we have some operational experience as it pertains to delivering AI solutions, whether it be communications or healthcare, before we're announcing it to the world that we're utilizing AI in some capacity. Because I believe a lot of what we're doing today is really around, I just want to get on the bandwagon and say we're doing the AI thing. Well, it's not a critical component of our operations. And
yeah, I mean, that seems to be where the industry is landing, is that we've got to experiment, we got to understand it, but it's kind of a skunk works kind of over here kind of thing that's, it has to be for good reasons that you described.
Well, I think that once you have some use cases and you've done some experimentation, you've tested in the market with the client, then you have a unique position to actually speak on it. And one of my greatest examples was John Hopkins. I worked with GE Healthcare for a number of years, and we delivered a hospital bid analytics system that predicted the traffic of hospital bid for John Hopkins system. And the team, we delivered that system. We use cased it with one of the hospitals at John Hopkins. We created our champions internally with John Hopkins, and then slowly started to deliver it to other components of John Hopkins. The team was very cautious, and when it announced this new product in the market, which is now with several healthcare systems, but by the time they actually started to talk about it, that's several use cases in play with the actual client, with actual real data, actually out there in the field, tested and utilized. And it was significantly more valuable at that point because we knew that there was actually evidence and that the client can actually testify to actual evidence that the product actually brought in the market. And that's what I would love to see in the market when it comes to AI versus a lot of the fluff communications that we're getting about it today.
Yeah, I mean, the volume seems to be coming out full blast across every channel, right? It's just like I said, it's inescapable, and it's a distraction. I think in a lot of ways, it's a shiny pebble. Oh gosh, let's talk about this thing over here because it's fun and exciting. But the reality is, and I think you make a great case for it, that we're going to tread slowly here. We have to. I mean, I think the patients and customers are going to expect that as well. I mean, you're already starting to see research and articles coming out about, people are starting to go, hey, kind of this AI thing, hold on a second, maybe interacting with a real live human being isn't so bad after all. Well, great, Wylie. This has been a pleasure. I've really enjoyed learning from you. I that was my expectation inviting you on, that I was going to learn something, and I did. And I think I have a much better sense of the scope and gravity of what's going on in the healthcare space from an innovation perspective. And you provide a lot of great ideas about how to navigate that, and not ideas, I think proven strategies that you've actually put to work with a lot of clients. So thank you very much for your time. I appreciate it.